Now this will be our first lecture as regard this beautiful subject of what abnormal uterine bleeding. Okay, so they usually abbreviate it as what AUB. Okay, abnormal uterine bleeding. So abnormal uterine bleeding is basically any bleeding from the uterus is heavy. Yeah, it could be outside menstruation, or it could be during menstruation, but it's now too much than the normal menstruation bleeding. Do you understand that kind of thing? So there are several ways, okay, of defining it. So it just refers to menstrual bleeding that deviates from the normal frequency. Okay, duration of volume is not related to pregnancy. Okay, and is not related to pregnancy. Do you understand? So includes any of the following: bleeding more frequently than every 21 days, or less than every 35 days. Now that's why they were saying that it refers to menstrual bleeding. It mustn't be menstrual bleeding, right? It can be outside the menstruation cycle. Then even if it is menstrual bleeding but it lasts more than 7 days, okay, then if the person is bleeding and or they have to use many pads before that bleeding stops, then intermenstrual bleedings between period. That's why I said that definition you have to rearrange it. Okay, there's sometimes there's bleeding after sex. Okay, all of these are issues. So causes we divide it into structural causes and what non-structural causes, and we use a mnemonic known as a palm coin to actually arrange this and make it stay in the head. So the P in the palm is polyps, so it can be caused by polyps. The A is adenomyosis, where you're having endometrial tissues outside the uterine muscle. You can have leiomyoma, which are simply known as uterine fibroids. It could be due to cancers, it could be due to what? Overgrowth of tissues, So we have coagulopathies. That's for the non-structural issues now. So non-structural ones, that means you can't really hold on to a physical thing that is causing the issue. So it can be a generalized body issue, like the woman is having disease condition that is making blood clots very slow. So you have general bleeding, also bleeding the uterus. So ovulatory dysfunctions, that's coagulopathies, right? The first one. Ovulatory dysfunctions, endometrial lining issues. Sometimes it's due to a surgery. Then the N in coin is when you say it is not yet classified, or you can say the cause is poorly understood. Right? So issues that such patients will be having when they have abnormal uterine bleeding is their menstruation bleeding is longer than the normal, is heavy, irregular cycle, so they are not bleeding within 28 days again. Okay, bleeding between periods, fatigue, or signs of anemia. You diagnose it from medical history and examination, then can do imaging just to confirm the structural issue causing it. Then you test all the important hormones to a woman, endometrial biopsy if needed, the complete blood count or coagulation profile. So treatments, sometimes hormonal treatments like oral contraceptives, progestins. If you are dealing with inflammation, use non-steroidal anti-inflammatory drugs. Then if there's polyps or fibroids, use surgeries to actually take them out. Endometrial ablation, hysterectomy in severe or refractory cases.